Well, hello everyone, and thank you for joining us this afternoon for our uh, first of what we hope will be many panels focused on the healthcare sector and issues that are of interest to the healthcare economy. I'm Tony Lasasso. I am a professor here in the DePaul University Economics Department, and I am thrilled to be inviting here shortly our two panelists today. First, though, I want to take just a moment to kind of set the stage. First, locally, here in the economics department, we are really beginning to do a lot more in terms of healthcare. And we're excited to be offering a MBA program in an MBA concentration in healthcare analytics, and that will be starting this year. We are also offering more courses in focused on health economics. And so, like I said, we're going to be doing more of these. We have another panel that's currently in development for the week after the election, and it's going to be whichever way the election goes. We're going to talk about the implications of the election results for healthcare markets. So stay tuned for more information on that. So I think it goes without saying that the coronavirus pandemic has been life-changing for all of us. It's clearly and obviously a once-in-a-century type of event. And so it's affected all of us in untold ways. So what we're going to talk about today, though, we're going to hear from two experts on the subject. Cody Wing is going to start us off. He is an associate professor at the O'Neill School of Public Policy and Environmental Affairs at Indiana University. He's going to tell us about mandates versus voluntary responses to the pandemic and their effects on physical mobility and the labor market. Throughout, I invite you to use the Q&A function that you'll find down in your Zoom window to chime in with questions. Just keep them coming. We will have time after our two speakers present to go through your questions and have a nice conversation on the topic at hand. So without any further ado, I'm going to invite our first speaker to step up. I should have mentioned, though, that our second speaker, who will follow immediately after Cody, is Mike Miller. He is a associate professor here in the economics department at DePaul. And his conversation with us will be about COVID and the economy. So first, Cody Wing from Indiana, you have the stage.
Okay, thanks very much for having me. This sounds like a super interesting conversation. I'm going to talk today about a kind of a line of research that I've been doing with a very large group of people at Indiana University, as well as the University of Georgia, Ohio State University, and probably a few other places. So this is work from several different projects that I'm going to sort of summarize. And mainly, we've been interested in two broad topics. One of them is just the idea of social distancing, which is a kind of a buzzword, but it's used to summarize the idea that people are kind of avoiding each other or minimizing their contact with other people. And that's partly thought to be due to public policies, which have discouraged physical mobility of various kinds or interaction of various kinds. But it's also probably due to voluntary responses to changes in the health risks associated with interaction. So we've been interested in trying to measure how much that kind of behavior has changed and try to understand a little bit about how much is due to state and local public policy action versus private responses to the epidemic. And then, of course, we've also done a little bit of work on the labor market consequences of the epidemic and of these kinds of policies. So I'll talk, towards the end of my talk, I'll talk a little bit about those ideas. So this is dangerous because I think trying to show people some theory is a risky thing to do in any kind of presentation. But before I show you what's primarily a lot of empirical work, I just want to think a little bit about, how should we think about the way people behave? And there's lots of different economic models you could use to think these things through. But one frame that I like is the idea that people are really engaged in a kind of home production model. And so in this setup, consumers or people, individual people, they have utility function defined over some commodities. And so here I'm going to call them just consumption activities, occupation or work-related activities, and their own health. And these three commodities can't be purchased directly from the market. They have to produce them themselves, right, by combining market goods, their own time, and some interaction with other people. And it's that interaction with other people that's kind of the slightly new wrinkle. Normally we don't fixate on that as much. Over here I have the health production function, and it's slightly different as well from the other commodities. Here it depends on some market inputs, the person's own time, and the sum of the person's interaction with other people. And there's this parameter rho, which measures basically how dangerous or how much the risk of infection depends on interaction with other people. So in this frame, the epidemic is basically a change in rho. Everything else is supposedly staying the same. And in this kind of setup, there's going to be a kind of derived demand curve for people's interaction with other people, right? So you might expect that as rho increases, remember rho is the riskiness or the possibility that you could get infected with the coronavirus by contacting other people. If that increases, we expect to see a reduction in the derived demand for physical activity and the associated goods that it's used to produce. Okay, so that kind of reaction, that's partly what I mean by a voluntary response to the epidemic. So that because of this increase in risk, people would reduce their physical interaction with other people for a variety of reasons. They would reduce them without any government intervention. However, those reductions might confer benefits on other people as well. So there might be positive externalities from my own reductions in physical interaction with other people. And those externalities, they create room for government policy to make the situation better, to improve welfare, potentially. So what kinds of policies might you use in this kind of setting? There are a lot of possibilities, but I think three ways to organize things are, there are direct policies which try to directly alter physical interaction. So you could imagine a kind of Pickovian tax that you would put on physical interaction between people. If you could figure out a way to levy a tax on contacts between people, that would discourage physical interaction. You could also think of Pickovian subsidies for reductions in physical interaction or for distancing. So you could imagine policies of that type. You could also regulate the size of group events or mandate that certain large group events cannot occur. And then in a kind of softer space in between, you could just use a lot of marketing campaigns where you discourage or encourage people to limit their physical interactions. So those would be what I'd call direct policies. Indirect policies would focus on things that are complementary to physical interaction. So you might levy a tax on a complement to physical interaction, or directly regulate and close businesses or activities that where people purchase or engage in the complements to physical interaction. So you might think about these related goods as public transit, parks and beaches, restaurant meals, schools, things like this. So those would be indirect strategies. You don't focus on the physical interaction themselves. You'd focus on corresponding activities where you tend to use a lot of physical interaction. And then a last kind of strategy would be to target the health risk parameter itself. So here you might think of mask mandates or subsidies and encouragement to wear a mask as an example. Hand washing and cleaning and encouragement to do those things, that would be an example. And then in the longer run, the development of and distribution of a vaccine, these would be things that would alter that row parameter. And those are all kinds of things that governments could do to try to improve outcomes above and beyond the voluntary responses that people might have. Okay, so what actually happened in the US? Things happened quite quickly early on. So by the end of March, nearly everybody in the United States was living in a state that had at least one confirmed case of COVID, had issued a declaration of emergency, had closed some or all restaurants, and had issued stay-at-home mandates. There's this sequence of things that went down. And there is a definite timing to these things. So the first case tends to come first. Emergency declarations are another early activity, right? And towards the end of the policy sequence is typically these stay-at-home orders. It's not a precise ordering, but in most states, that's how it went. So in our line of work, we've been looking at trying to measure social distancing activity using data collected from cell phones and other smart devices. Today, I'm going to show you examples from two sources. One is SafeGraph, where I'm using a measure of time spent at home. And another one is PlaceIQ, which is what we call a mixing index. But there are other sources, for example, from Apple Mobility and the Google Mobility reports, and quite a number of other sources as well. These are records that are harvested from cell phone and smart devices, which include an app that contributes to the data vendor's resource. So these are convenience data sources, to be sure. There's no claim that the cell phones included in the database are a random sample of all cell phones or anything like that. But basically, each device is assigned a home address, and from the home address and the various locations where the cell phone visits during the day, you can create a measure of how much people are moving around and visiting different locations. So this first graph I'm showing you, this is one measure of one cell phone-based measure of mobility. This is the median hours that the devices in the state spent at home. Okay, the thin lines in the graph are individual states. The thick blue line is the cross-state average. Okay, and the idea is that the line slopes up over time. The light gray lines change from gray to red when that state issues a stay-at-home order, which is one of the stronger kinds of social distancing policies that states adopted. And a key thing to notice is that there's quite a lot of increase in time spent at home before any of the states adopt these stay-at-home mandates. And that's one casual bit of evidence that the large increase in time spent at home is not entirely due to government policy. Another measure that we follow is something called the mixing index. This is based on data, cell phone data from PlaceIQ. And what happens with the mixing index, roughly, is for each device, you collect up the set of locations that device visited during a day. And for each of those locations, you calculate the number of other devices that visited that location during the day. And then for the device, you take the average of all the average number of other devices that visited those locations. And that's how much that device was, going to places where a lot of other people were going to. Okay, and that's a normalized version of that is what we call the mixing index. And so here again, you can see that the mixing index goes down over time, right? So people are doing less mixing with each other as time goes on. But once again, a lot of the decrease happens before any of the states issue stay-at-home mandates. So it's a piece of evidence that there's a voluntary response. That doesn't mean that there's no response to the policy as well, of course. So how do we try to pry these apart? Our main tool here, and it's useful, but it's not exactly rock solid. There's ways that this doesn't work. It's hard to pry apart events that happen in such close proximity to one another. But our strategy is to use an event study approach. So essentially, this is a regression of a mobility measure like time spent at home or mixing at the state by day level on state fixed effects, year fixed effects, and then a series of dummy variables leading up to a policy change in the state, okay? And what we're hoping is that, the alphas, the pre-policy measures, are basically all equal to 0. So there are no differential pre-trends associated with the timing of policy adoption in each state. And then the beta coefficients trace out the effect of the policy. And remember, this is all done at the day-by-day level. In this setup, the time period fixed effects, gamma t, those represent the time trend that would have happened in the absence of the policy. And so that's the sense in which we are separating the policy action from the general trend that would have happened anyway. So you can crudely think of the gamma t as tracing out the voluntary response and the beta b as tracing out the policy-induced response that happens on top of that. Okay. So we run these kinds of regressions for several different policies and a lot of outcomes. So these are some examples. This is showing the dependent variable is the time spent at home. And there's 4 policy measures we're looking at in this slide. The first is emergency declarations and first deaths. That's on the left. And then on the right, we've got school closures and stay-at-home policies, which happen a little bit later. We find the biggest effect, the biggest response in the event studies comes from emergency declarations, which happen relatively early in the sequence of policies that states adopt. I think the safest interpretation of this is that the emergency declarations are proxying for the whole sequence of policies. So they're like a reduced form bundle. But another interpretation is that those are early information-laden responses that the state is basically telling the population that they should take this seriously. But either way, we see kind of large changes, large increase in time spent at home that's associated with the timing of emergency declarations at the state level. So that's evidence that there is some responsiveness to state level policies. The question is how much of the overall change in mobility patterns came from those induced responses versus the sort of latent time trend, the gamma time trend that would have happened anyway, right? So this is the mandated effect versus the voluntary effect. So this is a graph that tries to decompose the two. The orange line in the graph shows you, averaged across all of the states, shows you what actually happened. This is the change in time spent at home over the early epidemic period. And what you can see is that time spent at home went from about 9 hours to almost 14 hours from the last week in February to the second week in April. Okay, so those are those 2 square points. The dashed line, the dashed blue line in this picture, shows you what happens if I remove or subtract out the event study estimates of the policy effect. So the dashed blue line shows you how much time spent at home would have increased if you only had the voluntary responses, you didn't also have the policy effect. And in this case, The idea is that the emergency declaration policies, had they not been issued, time spent at home would have only rose to 11.3 hours, not all the way to 13.9 hours. And by that calculation, that suggests that about 55% of the overall rise in social distancing, time spent at home, was due to public policy, and the sort of remaining amount was a voluntary response. So that's one way to decompose this. Okay, so I'll try and wrap up here and look a little bit at labor market outcomes. So as you might imagine, this big change in physical mobility, some of that implies that people aren't going to work, or that at least that consumers aren't engaging in the same kinds of activities. And that's one way that the epidemic has affected labor market outcomes. So if you just look at overall employment, this is a bit of a dated graph at this point, but there's a huge cliff, a huge drop off in employment that happens very early in the epidemic. So one way to put this in perspective is to compare changes in employment by demographic group in the early part of the COVID-19 epidemic. So this is just February to May change in employment, and February to April. Those are the two, the dark gray and light gray bars in this graph. And those are compared to the peak to trough change in employment from the 2001 recession and the Great Recession. And the idea here is that in the first few months of the COVID-19 epidemic, there were larger changes in employment than in the entire Great Recession. So that's a fairly daunting summary measure of what's going on. And it's not uniformly distributed. There's large changes for basically all groups, but there are bigger job losses for younger workers, for Hispanic workers, and there's smaller declines for people with advanced degrees. So there's a bit of a socioeconomic tilt there as well. Another thing we did is tried to look at how the rate of recent job losses are associated with job characteristics. So we use data from the ONET, which is a survey of people working in particular occupation codes, and it asked them a lot of questions about what exactly it is they do in their job. And we use that information to construct an index of how remote work friendly a particular type of job is. And then we compared rates of job losses in occupations that have high scores on our remote work index versus low scores. So high scores on remote work index means a lot of your job, you say in an earlier survey, pre-epidemic survey, people report that in this job, you use a lot of email, you write reports, you talk on the phone a lot. Okay, those are indicators that we say your job is remote work friendly, and we find that job losses are a lot lower, as you might expect, in occupations where there's a capacity for remote work. We also created an index measuring how much face-to-face interaction is a part of the job. So whether you have to interact with coworkers or with customers or clients versus not, or you work outdoors. These are kinds of face-to-face index measures, okay? And we find that the job losses are higher in occupations that score highly on those measures, okay? So I guess I'm gonna end there, but I'll just leave put this slide up at the end, just saying like an interesting thing to think about here is what comes next. So the state level policies to date have been primarily concerned with social distancing policies. The federal government has been focused on some amalgam of a rescue aid bill and a stimulus package. And I think an interesting line of research is what has been the effect of the different elements of that initial bill, the CARES Act, which used large income transfers to people, also modified the unemployment insurance program and experimented with these paycheck protection loans, as well as subsidizing those sort of infection risk policies. There's probably more to be done on that front. coming for us in the future, and thinking about what the implications or what the best way to do that is, I think is an interesting way to go forward. But I will stop there.
Thank you, Cody. Really interesting stuff. We're gonna hold off on questions until we hear from our next speaker. A quick comment. This is being recorded, and this entire presentation will be available on the Economics Department YouTube channel. So at some point, I'll ask you to hit the like button on this video and share it with your friends. I guess I just did. So I'll do it again later. But and also, again, please use the Q&A as questions occur to you. We will have time to go through your questions. So now I'm going to turn it over to Professor Mike Miller, who is an associate professor here in the economics department. So thank you again, Cody. The crowd is going wild, and take it away, Mike.
All right. I'm going to talk about the effect of COVID on the economy. And I'm going to, as economists always do, I'm going to show you a bunch of graphs and try to explain what those graphs are telling us. First thing I want to tell you, to remind you, is what a different world we had a mere months ago. Let's go back to essentially the start of March. And we were in what macroeconomists would call a long-run equilibrium. We had full employment at 3.5%, which, by the way, was the lowest rate in 50 years. GDP was growing at its potential of 2%. Inflation was under control. Payroll jobs, that's where you work for somebody else, were being created in numbers just sufficient to absorb all the new entrants to the labor market. And the nice thing was that inventories, which were created by firms to meet the needs of the consumers, were very much in line with expected sales. So when you put all these things together, you come to the conclusion that not only was the economy doing well, but the outlook going forward, without knowing that the pandemic was going to hit, was quite bright. The Federal Reserve had achieved what is called a neutral policy position, neither stimulative nor contractionary. The deficit was going to be a pretty big one of $1 trillion, but relative to the size of GDP, that wasn't real big, especially compared to some of them in the past. And if you go to some, what I call reputable sources, some private economists, as well as the Federal Reserve that we trust, looking forward, the economy was going to grow, it appeared, throughout 2020. And there was a good chance that if anything bad was going to happen, it wouldn't happen until 2021. So we would have, and that would have continued, by the way, the longest expansion in the history of the United States. Even with COVID, we still had the longest expansion in the history of the country. Now, a recession hit, of course, caused by COVID. But let's take a look at, just so we have some context. A downturn in the economy is usually associated with some kind of change in what economists call animal spirits. And in these, there we go. In these animal spirits, there's going to be usually some kind of a shock, an energy price shock. Almost all of the recessions before, say, the year 2007 were somehow tied to major increases in the price of crude oil. The one in 2007 was a financial market shock. And there can also be these imbalances when corporations all of a sudden build up piles and piles of goods that it turns out nobody wants. During the 2001 recession, that was part of the issue. So we would expect that the recession, which was going to hit at the end of the longest recession, would be somehow tied to this. But of course, we now know in retrospect that is not at all the case, that what we had happen to us was a unique cycle. And I think I'm of the opinion, and I think this opinion is rooted in reality, that there was one initial cause and only one initial cause of the recession which we are coming out of. And that was the demand by the federal and state governments, as I state, for businesses to stop producing, workers to stop working, and shoppers to stop shopping. We could just simply call this a shutdown. Now, what has happened since then, since the shutdown, is the economy has begun to rebound, but not as fast as many of us would hope. That you would think that once we know exactly what we're facing, that the economy would come back instantly. it turns out that some research out of the University of Chicago is showing that even though we have reopened, what seems to be slowing down any kind of return to normal is that people are afraid. The fear of going out because you might get the disease is what is explaining this weakness in the economy. And it is clear, you know, with many business cycles, no two recessions are alike, but this one is unique. There's nothing in U.S. history that comes even close. Now, what I want to do is I want to show you some graphs, and what these graphs I think will show you the magnitude of the change that occurred to us in such a short period of time, and then a lot of this rebound is going to, we hope, come relatively quickly. So here, for example, is the drop in gross domestic product. Now, I was thinking of starting out with just the bars without including the recession and the pandemic, and you would see that on the axis, on the vertical axis would be +5 or +6%, but on the bottom it would be never below, say, 10%, because we've never had a collapse in the economy greater than about 10 or 11% in history. And you can see that the GDP, the next to the last bar on the right, began to decline in the first quarter of 2020. And I want you to understand that decline all occurred in the last 3 weeks of the quarter. If you would look at all of January, all of February, and the first week or two of March, the economy was booming. Employment was booming. And it was that absolute collapse that made the first quarter decline. And then we had the largest decline by a magnitude of roughly 31% in the second quarter. We do expect, by the way, that the number for the third quarter will be this bar completely flopped on its head. It'll be some kind of an increase of around a 30% annual rate. Now, I've done this as well. You can see this as I call it historical context. I went back to pick up at least 2 really bad recessions. The gray bar, the first one, if you're coming in from the right, is the Great Recession. And then on the far left of the graph would have been a very bad recession, as some of us are old enough to remember, in the early 1980s. And you can see that the decline in GDP is magnitudes greater than anything that has ever happened before. And that's what makes this so interesting to macroeconomists. Now, the same thing is true of something which we call payrolls. Now, payrolls represent jobs where you work for someone else. So the only people excluded here would be farmers and the self-employed. And you can see that if you look at the whole line without looking at the COVID experience, it barely moves. It's practically a straight line, but that's because of the nature of the magnitude of the change. Now, until the pandemic hit, the greatest one month change in payrolls was about 1 million. And now you can see that we had to go down to 22 million as the only way to capture the entire pandemic effect. So we look at major swings that occur, and they essentially disappear because we change the vertical axis to capture what happened. And you can see as well that there's this enormous rebound where we have, in 1 month or so, we have an increase of 4.5 to 5 million new jobs in just 1 month, which is magnitudes greater than any single month ever before that. Now, let's take a look at where we stand, though. You know, if we have these major swings, we can see that the total number of payroll jobs went from about 152 all the way down to 130. Now, we've rebounded quite well, but even with all the increase that has occurred over the past couple of months, and we are recovering and doing better, we are still 10 million jobs below where we were in February, which is 7% below. And for what it is worth, that is greater. We're still greater below our previous peak than we were at the depths of the Great Recession. And this excludes that dramatic decline that occurred in the early months of the pandemic. Moving on to the unemployment rate, you can see that unemployment jumped up to just under 15% from 3.5, the lowest rate, by the way, in 50 years, to 14.7, which is, by the way, the highest rate since the Great Depression. The last time we would have had any number like this would have been in the late 1930s when unemployment was running around 15%. In the depths of the Great Depression of the 1930s, unemployment hit about 25%. But this 14.7% is the greatest unemployment spike ever. Now, we're already down to 7.9, and I can tell you that at the time when we hit 14.7, most economists said we would probably be in double digits throughout 2020 and into part of 2021. So we are making progress a little bit faster, or maybe a lot faster than a lot of people thought, but we're still a long way from being back to where we were before this whole thing began. Now, here's one I wanted to show you because it has become a major reported item that usually was only looked at by a bunch of nerdy economists like myself, but the public has been inundated with data on what are called initial claims. Now, what happens is if you're working for somebody else and you are laid off for no reason that where you did something wrong, like steal from the firm or whatever, you can collect unemployment compensation from the state. And you can see here that this is since the 1980s. You can see the largest increase in any given month, or week, I should say, in which people have signed up for unemployment insurance was under 700,000. And in the depths of the Great Recession, it was about 680,000. Now see what happens when I move this into the pandemic, and it's astounding what happened. Of course, those huge swings essentially all disappeared. And instead of the vertical axis having to peak at around 700,000, it has to peak at 7 million. In other words, a magnitude of 10. Had you said to me in the months before this occurred that we were going to have an event in the United States where 7 million people would sign up for unemployment comp in 1 week, I would have told you you were nuts. Then you're just, let's not talk because you're just talking nonsense. But of course, one thing about this pandemic, these graphs show that things happened that no one could have ever seen, could have never planned for, essentially. There is one good thing about it. Inflation in the economy remains untouched. You can see the last time we had a bad recession in 2007, the first gray line, if you're coming in from the right, unemployment really never got above 5, and for a while it even fell into what we would call a brief period of deflation. For those old enough to remember the recession of the early 1980s, we had what was called stagflation. Not only did we have high unemployment of 10.8%, but we had inflation that was running as high as almost 15% on an annual basis. Inflation has been under control for the past 25 to 30 years. And during this pandemic, inflation has not been an issue, which is, by the way, not unusual during a recession, because how can firms raise prices when they don't have customers? So inflation does, however, remain under control. Some people feared that there would be a spike in prices caused by panic in people, and they're going out and trying to buy whatever they could buy, but that inflation never occurred. This graph, it is just so stunning, and it happened not long after the recession began. This is from sometime in April. I want to take a look at the commodity called oil, and this is West Texas Intermediate, and this is what is called a spot price. And a spot price means you have to take the delivery in the next 7 days. So in other words, if you buy this oil, you've got to have a place to put it. Now, who would believe that a commodity as valuable as oil, as rare in terms that people want throughout the world, that has a world price, would have a negative price of minus $36.98 per barrel? What this tells us, that things got so crazy during this pandemic that firms were paying people $37 per barrel to take oil off of their hands because they had nowhere to put it. They may have been ready to take delivery on a contract, and they had oil which they just did not know what to do with, and they were going to pay people to take that oil away. And this is another one of these things. Had you had said something like this, that a product as valuable as oil would have a negative price of this substantial amount, I would have told you that you're just crazy. There's no use talking. All right, now, also, if you look at healthcare, I know this is a healthcare discussion. I happened to find this really nice graph that looked at spending by households. And what the zero represents is when we would get out of a shutdown. And you can see then event weeks after the shutdown. And what this graph essentially shows that during the shutdown, people were simply not buying healthcare. My own family was a case of this, and as soon as things opened up, we had a surgery in my own family that we had to wait because of this, and the amount of healthcare spending was rising at almost a 20% rate 10 weeks after the shutdown was over. So clearly the shutdown did have an effect, but it's also that fear. To this day, there are people still afraid to go to doctors, and that's affecting the amount of spending that is going on in the economy. Now, as Cody mentioned, the federal government responded to what was going on. And the data I've been able to find from the Committee on a Responsible Federal Budget, as well as from the CBO, that's the Congressional Budget Office. So far, the federal government has allocated for the next couple of years, $4.6 trillion, of which $2.7 trillion has already been spent. Now, the deficit, as I mentioned before, we thought was going to be about $1 trillion. It appears that the fiscal year the government just ended a few weeks ago is likely going to be 3 times greater than we thought. It's going to be 3.3 trillion instead of 1 trillion. And this action by the federal government, which we would call discretionary fiscal policy, was comprised of the following items I list there on the slide: a loan program, tax changes, income support. And then there's the health spending that they're going to take care of, testing and things like that, direct payments to people like you and me, and then aid to states, where they give the money to the states and the states then use the money where it is most needed. Now, some of you, those of you who have had some economics know that there's this item called a multiplier, and it asks the question, if the federal government in its discretionary policy were to spend an additional dollar, would the GDP rise by a full dollar, or would it be something greater than or less than $1? And under the concept of a multiplier, we would always hope it would go up by, say, $2 or $3 because as it ripples down through the economy. The best estimates we have, and these are very early, so I want you to understand these are not locked in, but these very, very early estimates from the CBO show that all of the major programs, the paycheck, the PPP, the coronavirus release to the states, and the unemployment insurance and so forth, all had a positive multiplier, but they were all, by the way, less than 1. So for each dollar the government spent, GDP did not go up by a full dollar. It went up by something less. So you can think of this: for each dollar, 88 cents for the fund to the states and so forth. So we can say that federal government spending is having a positive effect upon the economy, but it may not be as large as some of you think, because the government doesn't have any of its own money. It can only get the money by either printing it, taxing it, or borrowing it. And when you borrow from people who would otherwise use it. And so you have something which we call crowding out, and the federal government, therefore, doesn't have a multiplier as large as you might think. Also, what happens is when an economy falls into a recession, you would hope that you would completely bounce back, say, within 1 year or so, or 2 years especially, and you would go back to the long run trend for the economy. This is also done by the Congressional Budget Office, and what it tells us is that this particular cycle is probably going to lead at the end of 1 year, which will be sometime in March of 2021, the economy will be, in nominal terms, not adjusted for inflation, about $1.1 trillion smaller than it would have been had the pandemic not occurred. And within 5 years, it will multiply itself and will be as low as $3.6 trillion smaller than we would have been. This is the basis that some are using to argue that the federal government needs to bring in another stimulus package to try to reduce this amount of the output gap. Only a few more here. The Federal Reserve, by the way, also responded. The Federal Reserve is the country's central bank, and they have something called monetary policy, and that's where they manipulate money supply and interest rates to bring about changes in the economy. And their goals are generally stable prices and maximum employment. So clearly inflation was not an issue, so their focus would be purely upon the issue of employment. So what they did is what they did during the Great Recession. They lowered interest rates to what we call the zero lower bound. And they have told us it will remain there for as long as we can, for a long time. I think they said through 2021. Of course, they would raise it if the economy all of a sudden took off. but it appears that interest rates are going to be low at zero for as far as we can see in terms of general policy making. And they did something else. They injected liquidity. We had to make sure that there were dollars available to those who needed it anywhere in the world. And so what they did is what the Fed does is they buy securities off of the market, bonds and other kinds of mortgage-backed securities and so forth. And when they buy these items, they create money to buy them. They create money out of thin air. And the Fed bought roughly $3 trillion worth of assets in a matter of months. This was even during the Great Recession, when we had what were called quantitative easing, QE1, QE2, and QE3. In none of those did it rise by as much as $3 trillion in literally a matter of months as opposed to years. And the Fed's balance sheet, which at the start of the Great Recession, so the 13 years ago, was at about $800 billion, is now well over $7 trillion. And it is 69% larger than it was just in February. So the Federal Reserve has pulled out all the stops. They have just done everything and anything they could to make sure that they can inject liquidity and stability into the financial markets. So if you find this interesting and you'd like to ask me for these particular slides, you can contact me at mmiller@depaul.edu. And if you do, or if you have a question about the economy that might be related to this presentation, just put in the subject code COVID presentation, and then I'll know what it is that you're asking about, and I'll get to it, and I can answer your questions.
Thank you very much, Mike. And thank you, Cody. You're both back with us now. That's terrific. We do have some questions stacked up.
Okay.
And I think we're gonna have a hard stop at 5 p.m. here local time. So let's see. I have one by text that I want to just throw out there to both of you. I mean, do your best with it, but I guess be brisk in answering it. So there's this argument that actually popped up today in the news today about, and Sweden has long been mentioned as sort of this model of basically trying to move the country more rapidly towards a herd immunity situation, and you can feel free to define herd immunity, maybe Cody, but I guess my question, or the question is, that as a policy alternative, while still protecting people who are at risk, older adults and others with predisposing health conditions. So thoughts on that, Cody, and then Mike.
Well, so herd immunity is very roughly speaking the idea that if enough people have been infected with the virus and recovered, then those people, each of those people, possess, at least for some period of time, antibodies, which make it far less likely that they can be reinfected. And as the number of people who have active antibodies grows, it gets harder and harder for the virus to pass from one person to the next. And that's one way that an epidemic is going to be a self-limiting phenomenon. The question is, so at some point, the growth rate of new cases would really start to decline because there would be nobody left to get infected. The question is, how long would it take us to get to, enough people who possess antibodies for sort of decline of the epidemic to kick in, and how costly would it be to accomplish that? So much depends on where you think the damage to the economy is coming from. If you think that the damage to the economy is coming from, in large part, people's private reaction to the fact that there's risk that they'll become infected, okay, that they're avoiding going to restaurants and avoiding normal activities because they don't want to get infected, then getting ourselves to herd immunity will take a long time because people will resist that effort. They will not expose themselves, so they're not going to rapidly all get infected and dial up to herd immunity in a month or two. And then on top of that, the process of sort of uncontrolled spread, this would mean, dial back on any efforts to encourage social distancing, would likely come at a kind of high health cost to the economy. So I'm not terribly optimistic that that would be, a desirable course. It might be the course that ultimately happens. In some ways, if we have a vaccine, we seek the same outcome. If you were able to somehow magically mass vaccinate the population, we'd have a kind of herd immunity. It would just be artificially generated. So I don't think the question is like, do we ever want that? The question is like, what's the most efficient path to get ourselves there? And if I had to guess, it's probably that we should hold out and get a vaccine to get us there, rather than just go out and kind of deliberately infect yourself. That seems unwise, I think, or impatient, overly impatient. But I guess it depends how quickly you expect a vaccine to show up. If you think it's going to take a decade, then we're probably going the herd immunity path, Anyway, I'll stop there. I'm not sure there's a coherent answer available, but best I got.
And I think I'll give a different answer. And I come from a position, I think we're all economists here, and looking at a cost-benefit analysis of the dramatic drop in the economy and affecting mainly the people on the bottom, not people like you and me. And also coming from the position of one who values almost as much as anything in the world civil liberties and individual liberties. I think this shutdown was the greatest social policy error in the history of the country. As far as I know, based upon my reading of things about this, no epidemic ever has been responded to by shutting down the economy. And this even includes in my own family. A member of my family contracted polio during the polio epidemic. And while they quarantined the house that we lived in, they did not quarantine the country. I think protecting those who were most vulnerable was a perfectly good idea. But I think when this is all written, we will see that the cost to the economy, most notably those on the bottom, will dramatically outweigh the benefits that we got from any kind of a shutdown. And I believe there's already some research showing that that is the case, that shutdowns are not associated with dramatic changes in the progression of the disease.
Okay, thank you both for that. I'm gonna switch into macro gear here. This is probably a little more of a Mike question, but I'm gonna try to combine two questions. One is fiscal policy. So I'll cut to the chase here. We deficit, as you said, of close to 4 trillion. National debt around 27, larger than the economy.
Yes.
And then you can dovetail that any way you like with a monetary policy question. Do you think that a Fed with a $5 trillion balance sheet is the new normal in this kind of environment? Or so have at it.
When it went from suddenly 800 billion to 4 trillion, that was the question. And I went to a panel which included the former president of the Chicago Fed, and he said at the time, I have no idea what will be the new normal for the Fed's balance sheet. It seems to me that this will be the normal, at least for the next decade or so, that the Fed will hold a massive quantity of securities. The last time when they tried to move down from 4.2 trillion, they only lasted about 6 months, and the markets did not respond greatly to it, and they decided to stop. In terms of discretionary about the fiscal policy, there is this question. You have those who like small government, of which I'm one of those, and I don't like the idea of government taking over as much as they do. But there's one interesting thing about this pandemic is that essentially the government caused it. So if the government breaks it, I think it's part of the job of the government to fix it. And one that I also found when I showed you those particular multipliers, the thing that I found surprising, but I have to go where the data take me. I know there's a battle within the government as to whether or not there should be aid to the states. And that's the big separating thing between Pelosi and the president. And the highest multiplier that we have for the various programs that we've used is the one that involves aid to the states. It had a multiplier of 0.88, which was higher than the other multipliers. So it does seem to be that aid to the states, where they maybe know where to put the money the best, would be the thing to do. And part of the reason to have a government that can run it up its credit card is for exactly periods like this. We shouldn't be doing it in times of growth, but the idea that fiscal policy, we'll worry about the recession, the deficit and the debt later. Maybe we should try to do something to get it under control, but this is actually the time that you would want to use this particular policy.
So on this one, I'll have to say, I have no idea about the Fed balance sheet and whether that's the new normal. It's very far outside my space. And I'm not a macroeconomist. So you should probably discount a lot of my views on these issues. I think, however, it is strange, a little bit strange, to try to think about federal spending and fiscal policy in the current environment through the lens of stimulus effects. It's not that those effects might not happen. It's more that I don't think it's appropriate or correct to think about this as a demand shock to the economy that's happened. I think it's probably safer to think of it as a kind of supply shock, that the same kinds of goods and services holding health and safety constant can't be produced currently. So spending more money is unlikely to sort of fill the gap in the way that it normally would. And you know, I think that can sort of lead you astray in your thinking a little bit. That doesn't mean we shouldn't do some of these things. It might be very sensible to use government resources to try to speed up or subsidize or encourage the production of vaccines or the development of vaccines, for example. And it might make good sense to try to provide liquidity to markets or to provide some kind of insurance or aid to displaced workers temporarily. Those things all make sense, but I'm not sure they will lead to some rapid growth in GDP. I don't know, I'm not sure.
No, what you say makes sense, by the way. You are correct. It is not a demand shock. Not in the normal sense of the term.
So we've got about 2 minutes left here. I want to keep us on target. So I'm going to try to get a 1 minute answer out of Cody here for a question, and then one for Mike. So Cody, I think this is a question here about briefly elaborate on how you made sure that the impact of different policies on the outcomes of interest are sort of isolated. And I guess my thought on that is, you know, emergency declarations kind of had a lot of the action in your results, but is it that it spawned closures? Like that was, you know, it's a lot of stuff happening at once. And then, and I guess for Mike, right after that, more macro oriented, speculation on future economic recovery. I mean, when, you know, temporary job losses, when do they become permanent? And then when do we start to get nervous? So you got a minute. So
it's super hard to separate all of the different state level policies. As one of my slides shows you the sequence of events in each state, and sometimes they're separated by like a few days. So we run specifications where we control simultaneously for all the different policies, and I don't super believe them, okay? In my opinion, the most conservative interpretation of the emergency declaration effects is that you should think of the emergency declaration effect as the starting bell for the sequence of policies that's going to happen. And so maybe you should think of that as a commingled effect of everything that's going to come. That's hard to separate from a competing interpretation, which is that the policies that have mattered the most have not been the coercive ones, which actively shut things down. They've been the ones that basically supply information to the population that, hey, this is a real thing. You should wash your hands more. You should consider not going to work and working from home if you can, blah, blah, blah. Those kinds of things. It's possible that those policies are ultimately more effective than some of the more coercive policies. But I would say literally prying them all apart. We try it. I don't think you should believe it too deeply. What's true is that the response happens most sharply for the early and information-laden policies, but those could be capturing the downstream effects of other policies too. So I don't know if that really answers your question, but I'm with you if you think that's a problem.
In terms of the forecast, I'm not one who believes that macroeconomists are all that valuable when it comes to forecasting, especially in times of crisis or change like now. Our record is not that good. I'm one who tends to merely describe what I see and try to draw reasonable inferences. But of course, the question people always have is, where are things going? People that I respect and forecasts which I've looked at say that the economy should be maybe back to normal by the end of 2021. Unemployment then might be down around 5 to 5.5% or so, and that would be a pretty decent number given the demographics. What is clear, though, and I think in terms of its demand effects and so forth, is that people are not going out as much, partly because they fear things. And once that fear could be abated, either through herd immunity or through maybe some kind of vaccine, I think that will make the economy grow faster. In terms of the jobs, the temporary job losses, and that's why unemployment never quite spiked to 20 or 30% as we expected, because so many of the jobs were temporary unemployment. The numbers for the first time claims are a little bit disturbing in that they've hit a plateau and they just can't seem to get below 800 and some thousand, which tells us that some of the energy of the labor market is now spent, and that the big increases we've had so far are not going to be quite as large, and therefore there might be a second wave of job losses which are permanent as opposed to temporary, and that's a negative which would draw down on that long run forecast, and that's why the end of 2021 is probably a safe bet.
Well, thank you. Thank you both for your comments here today. We do have more questions, but we are out of time. We could probably, go through the night actually on this topic. Again, I want to thank all of our participants here, all of our attendees. I want to thank very much Cody and Mike for their presentations and for their time and for all of their deep thoughts on this hugely significant topic. As I said before, this video will be recorded and made available on the Department of Economics YouTube channel. So like and share, of course, and I hope to see you again soon at an upcoming event. So have a great evening.